Assalamu alaikum. I am Dr. Abdul-Aziz Youssef. Welcome to today's lecture on our hospital policies and procedures for mortality and morbidity, Part 1. We will examine key aspects of healthcare policies through practical questions. Question number 1. A patient with terminal cancer is admitted to the hospital. The medical record indicates and the clinical assessment confirms signs of impending death. This is an example of A. Expected mortality, B. Unexpected mortality, C. Mortality, D. Morbidity. The correct answer is A. Expected mortality refers to death that is expected at the time of admission, as evidenced by clinical signs and symptoms of impending death. Question 2. A young patient admitted for minor surgical procedure in which he had a fatal cardiac arrest and passed out. This is an example of A. Expected mortality, B. Unexpected mortality, C. Mortality, D. Morbidity. So the correct answer here is B. Unexpected mortality refers to a death that wasn't anticipated at the time of admission. And this patient has sudden cardiac arrest, but initial minor condition and the young age classified as unexpected mortality. Question 3. A patient admitted with no signs of critical illness. Then he deteriorates during hospitalization and eventually passed away. This scenario is an example of A. Expected mortality, B. Unexpected mortality, C. Unexpected death, D. Morbidity. The correct answer is C. So unexpected death refers to a situation where death is unexpected at the time of admission or presentation, but becomes expected due to changes in the patient's condition during hospitalization. Question number 4. A patient undergoes a successful knee replacement surgery. However, post-operatively, the patient develops chronic pain and limited mobility, significantly this affecting their daily activities and quality of life. This scenario is an example of A. Expected mortality, B. Unexpected mortality, C. Mortality, D. Morbidity. The correct answer is D. So morbidity refers to consequences and complications resulting from disease or its treatment other than this, and these complications usually affect the quality of life for the patient. Question 5. A committee in a hospital department reviewing a case of surgical complication to improve care quality is functioning as Departmental Morbidity and Mortality Committee, B. Hospital Morbidity and Mortality Committee, C. Root Cause Analysis Team, D. Safety Event Report Group. The correct answer is A. So the Departmental Mortality and Morbidity Committee reviews case of mortalities and morbidities within a specific department. Question number 6. A hospital-wide committee that reviews cases of patient deaths and complications across all departments is known as A. Departmental Mortality and Morbidity, B. Hospital Mortality and Morbidity, C. Root Cause Analysis Team, D. Safety Event Report Group. So correct answer is B. So the Hospital Mortality and Morbidity Committee is responsible for reviewing cases of mortalities and morbidities across the entire hospital. Question 7. A process in a hospital where events like patient complaints, medical record reviews, and safety reports are analyzed to identify potential complications is known as. This process is known as A. Morbidity screening, B. Mortality review, C. Root cause analysis, D. Central event analysis. The correct answer is A. Morbidity screening involves methods to identify events that require review for potential complications. This includes reviewing medical records, reports, and patient complaints as described. Question 8. After a patient safety incident, a team conducts a detailed examination to find the underlying reasons for the event. This process is called A. Morbidity screening, B. Mortality review, C. Root cause analysis, D. Sentinel event analysis. The correct answer is C. So root cause analysis is a structured retrospective analysis to identify the true causes of an event or situation, as in this scenario. Question number 9. A report filed after an incident where a patient falls due to wet floor in the hospital, causing minor injuries. This report is an example of A. Morbidity screening, B. Root cause analysis, C. Safety event report or occurrence variant report or OVR, D. Sentinel event analysis. The correct answer is C. OVR is filed for undesired incidents affecting patients or the hospital environment, like patient fall, due to withdrawal, which is consistent with this definition. Question number 8. A patient undergoing surgery experiences an accidental anesthesia overdose, leading to severe temporary harm. This incident is classified as A. Morbidity, B. Mortality, C. Sentinel event, D. Safety event report. The correct answer is C. Sentinel event is an event that results in death, permanent harm, or severe temporary harm not primarily related to the natural course of the patient's illness. So we have here either death or permanent harm or severe temporary harm. So either permanent or severe temporary harm. And all of these not related to the disease, the primary disease or natural course of the disease. So as is in this case, the severe temporary harm caused by anesthesia overdose, not the disease, but to anesthesia overdose. This is called sentinel event. Case 11 or question number 11. A patient requires additional surgery due to complications from previous procedure but is expected to fully recover. This represents what? A. Expected mortality, B. Morbidity, C. Sentinel event, D. Severe temporary harm. The correct answer is D. A severe temporary harm involves critical, potentially life-threatening harm lasting for a limited time with no permanent residual. So the patient will recover, but requires significant intervention such as additional surgery as in this case. Question 12. A hospital uses a systematic method to detect patient harm incidents over time for safety evaluation. This method is known as A. Morbidity screening, B. Trigger tool, C. Root cause analysis, D. Sentinel event report. The correct answer is B. The trigger tool is a methodology for harm detection in a hospital used to track rates of harm over time and evaluate patient safety aligning with the scenario described. Last case here, case 13 or question number 13. A doctor holds over all responsibility for patient care at a given time is referred to as A. Consulting physician, B. Attending physician, C. Most responsible physician, D. Chief medical officer. The correct answer, of course, is C. The most responsible physician is a physician with overall responsibility for the care and the management of a patient during a specific period of time. Like a patient admitted under one physician in medical department for 1 week. During this week, the most responsible physician is the doctor or consultant under whom the patient admitted. If the patient came in another time admitted under the surgery department, the surgery consultant will be the most responsible physician at that time period. Thank you for joining us. Stay tuned for more policy reviews.